Did you know that the signs of dementia can show up years before memory loss starts to take a toll? What if we told you that recognizing these subtle changes early on could give you the power to slow or even stop the progression of the disease? Dementia doesn't develop overnight, it creeps in gradually, often in ways that are easy to overlook as simply part of aging. In this video, we're diving into the 12 early warning signs of dementia, explaining how they manifest long before the typical symptoms. But that's not all. We'll also show you exactly what to do if you notice these signs in yourself or a loved one, giving you the chance to act before irreversible damage takes hold. Stick with us to learn the strategies that could help protect your brain and preserve your future. Dementia is a slow and silent condition that can often develop years before it's officially diagnosed. While memory loss is the most well-known symptom, it doesn't appear overnight. In fact, dementia typically begins with more subtle changes that are easily overlooked as normal aging. Understanding these early warning signs is crucial because catching them early could potentially slow or even prevent further cognitive decline. Let's take a closer look at 12 early warning signs of dementia you should watch for. One of the first signs is a loss of sense of smell. Imagine waking up to find that your morning coffee has no aroma, or your favorite food doesn't smell the way it used to. This isn't just a minor inconvenience, it could be an early sign of dementia. Studies have shown that the olfactory bulb, which is responsible for processing smells, deteriorates early on in conditions like Alzheimer's or Parkinson's disease. A simple smell test could reveal a much higher risk of dementia within the next few years. Next, feeling unusually cold could be a red flag. If you find yourself bundling up or feeling chilled when others are comfortable, it might not be about the weather. This could indicate poor circulation to the brain, a significant risk factor for cognitive decline. Without proper blood flow, brain cells start to starve, leading to cognitive issues long before memory problems arise. Unexplained weight loss is another warning sign that many ignore. While shedding a few pounds can seem like a good thing, sudden and unintentional weight loss, especially in older adults, may indicate early-stage dementia. The brain relies on a lot of energy, and when it begins to deteriorate, it can affect the body's ability to regulate weight, causing muscle wasting. Frequent balance problems should also raise concern. Do you often feel dizzy or lose your balance more than usual? This could be an early sign of cognitive decline. Studies show that people who experience frequent dizziness, especially due to blood pressure fluctuations, have a significantly higher risk of developing dementia in the future. These balance issues are a result of the brain not receiving enough oxygenated blood, which can damage neurons over time. Another sign to watch for is losing interest in mentally stimulating activities. If you used to enjoy reading or solving puzzles, and now find them overwhelming or uninteresting, your brain could be showing early signs of decline. As dementia takes hold, tasks that once felt rewarding become difficult and mentally draining. Changes in food preferences can also be a subtle clue. Have you developed a craving for sweets, or do you find that foods you once enjoyed now taste strange? This could be a sign that the brain's taste perception centers are weakening. Dementia can interfere with the brain's ability to process flavors properly, leading to unusual cravings or eating spoiled food without realizing it. Struggling with recognizing faces is another early warning sign. While forgetting someone's name can happen to anyone, consistently having trouble recognizing familiar faces, even loved ones, is different. This is because the brain region responsible for facial recognition starts deteriorating before memory loss kicks in, making it one of the first areas affected by dementia. Declining handwriting is something to notice as well. If your handwriting becomes smaller, cramped, or harder to read, it might indicate cognitive decline. Dementia affects fine motor skills and coordination, making tasks like writing more difficult. Vivid dreams or nightmares could signal that something is off. Studies show that people who experience frequent nightmares are more likely to develop dementia later in life. The areas of the brain that regulate dreaming are closely linked to those affected by dementia, which is why disturbed dreams can be an early indicator. One of the most telling signs is social withdrawal. If you find yourself avoiding social gatherings or losing interest in spending time with loved ones, it could be a sign that your brain is changing. As dementia affects the frontal lobe, the part of the brain responsible for motivation and decision-making, people often become less interested in socializing. Losing track of time is also a symptom to be aware of. If you frequently forget the day, the month, or even the year, it may not just be a sign of forgetfulness. Early-stage dementia often causes confusion about dates and events, making it hard to maintain a sense of time. Finally, vision problems can be an unexpected warning sign. Difficulty perceiving depth, misjudging distances, or seeing objects that aren't there can all be linked to cognitive decline. Even though the eyes may seem fine, the brain's ability to process visual information can be impaired in the early stages of dementia. Recognizing these signs early gives you the opportunity to act before the damage becomes irreversible. If you notice any of these symptoms, it's important to seek medical advice and get a proper evaluation. Catching dementia in its early stages can make all the difference in preserving your cognitive health for years to come. Stay tuned as we explore what steps you can take to reduce your risk and protect your brain from further decline. Dementia doesn't strike suddenly, it's a gradual, silent process that unfolds over years. The cause of the early symptoms can be traced to a complex process of neurodegeneration, where changes in the brain slowly start to erode cognitive function. Let's break down the key factors contributing to this silent decline. One of the primary drivers of dementia is the accumulation of harmful proteins in the brain. In conditions like Alzheimer's disease, proteins such as beta amyloid and tau build up and form plaques and tangles in the brain. These clumps of protein disrupt normal cell communication, which is essential for brain function. As these plaques spread, they block vital pathways that neurons use to communicate, leading to severe damage in areas of the brain responsible for memory, learning, and other cognitive processes. Over time, these protein buildups contribute to shrinking brain cells, making it harder for the brain to function properly. Another key factor is reduced blood flow to the brain. The brain requires a constant supply of oxygen and nutrients to function at its best, and this is delivered through a network of blood vessels. As we age, blood flow can naturally decline, and in some cases, the tiny blood vessels in the brain can even shut down. Without the steady blood supply, neurons in vital regions begin to starve, leading to cognitive impairment. This reduction in circulation can make it harder for the brain to repair itself or form new neural connections, which are crucial for maintaining mental sharpness. When blood flow becomes restricted, it speeds up the process of brain cell death, worsening cognitive decline. Inflammation in the brain is another critical factor that accelerates dementia. In a healthy brain, the immune system works to clear out waste and repair damaged cells. But in people with dementia, the immune system begins to malfunction. Instead of protecting the brain, it triggers chronic inflammation, which can cause further damage. This persistent inflammation harms brain cells, weakens their connections, and makes it more difficult for the brain to recover from damage. Inflammation is a silent enemy, quietly destroying neurons and increasing the overall rate of cognitive decline. Together, these factors create a dangerous cycle. Protein buildup, decreased blood flow, and chronic inflammation all contribute to the progressive breakdown of the brain. As these processes continue, they impair the brain's ability to perform even basic functions, like remembering names or recognizing familiar places. Understanding these causes is important because it highlights why the symptoms of dementia often begin so subtly. The damage is happening deep inside the brain, and by the time the signs are noticeable, the brain has already been compromised. That's why early detection and intervention are key. Recognizing the early warning signs of dementia gives you a better chance of slowing or even halting the progression of these destructive processes. But how can we address these issues and protect our brains? Stay tuned to explore the lifestyle changes and actions that can help slow the effects of neurodegeneration and keep your mind sharp for years to come. Recognizing the early signs of dementia is crucial, as it can significantly impact the course of the disease. By the time most people notice symptoms, such as memory loss or confusion, substantial damage to the brain may already have taken place. This is one of the main reasons why dementia can be so devastating. It quietly progresses for years, often without obvious signs, and once the symptoms are noticeable, much of the brain's functioning has already been compromised. However, early detection offers a unique opportunity to slow, halt, or even reverse the progression of the disease. Catching the warning signs in their earliest stages, such as changes in behavior, memory lapses, or trouble with focus, provides a critical window for intervention. The earlier the damage is detected, the more options there are for treatment and lifestyle changes that can protect brain function. Early action could be the difference between living an independent, fulfilling life, and gradually losing cognitive abilities to a point where recovery is no longer possible. Moreover, early detection can slow the progression of the disease. There are numerous treatments and therapies available that, when implemented early, can help preserve brain health. Medications may help manage symptoms and slow cognitive decline. Lifestyle changes, like improving diet, exercising regularly, and maintaining strong social connections, can also have a positive impact. Brain training activities, such as puzzles and reading, can help maintain mental sharpness and build cognitive reserves, giving the brain more capacity to compensate for any early damage. Preventing the disease from advancing is another benefit of early action. By recognizing the signs of dementia and addressing them before the disease fully takes hold, it is possible to significantly reduce the risk of further cognitive impairment. Studies have shown that changes in lifestyle, such as eating a healthy diet, engaging in regular physical activity, and staying mentally active, can lower the risk of developing dementia in the first place. The most important part of early action is simply being aware. If you or a loved one notice changes that could signal early dementia, whether it's mild memory lapses, personality shifts, or difficulty following conversations, it's essential to seek help from a healthcare professional immediately. Getting a thorough evaluation can pinpoint the cause of the symptoms and open the door to treatments or strategies that can make a difference. The difference between waiting too long and acting early can be life-changing. Taking action while the symptoms are still mild offers the best chance for slowing the disease and maintaining quality of life for as long as possible. Next, let's explore some practical steps and strategies that can help slow or even prevent the progression of dementia if detected early. Taking preventive measures is one of the most effective ways to slow or even prevent the progression of dementia, especially if the condition is detected early. Small changes in lifestyle can have a significant impact on brain health, helping to protect against cognitive decline. Let's explore some key recommendations to keep your brain sharp and functioning optimally. Prioritize sleep. Sleep is one of the most important factors for brain health. During deep sleep, your brain has the opportunity to clear out waste products, including harmful proteins like beta amyloid, which are linked to Alzheimer's disease. Studies show that adults who get less than 6 hours of sleep per night are at a much higher risk for dementia. Ideally, aim for at least 7 hours of quality sleep each night. Creating a consistent sleep routine, reducing screen time before bed, and managing stress can help improve sleep quality, supporting brain health in the long run. Improve blood flow to the brain. Your brain requires a steady supply of oxygen and nutrients to function at its best. The Mediterranean diet is one of the most effective ways to support brain health and improve circulation. This diet, rich in healthy fats like those found in olive oil, nuts, and seeds, along with plenty of fruits, vegetables, and fish high in omega-3 fatty acids, has been shown to lower the risk of dementia. Omega-3 fatty acids, in particular, are known to improve communication between brain cells and reduce inflammation, keeping the brain functioning smoothly. Stay mentally engaged just like physical muscles. Your brain needs regular exercise to stay strong. Keeping your mind active with puzzles, reading, and other mentally stimulating activities is key to maintaining cognitive function. Studies have shown that people who engage in lifelong learning and problem-solving activities are better able to preserve their cognitive abilities as they age. Whether it's solving a crossword puzzle, learning a new language, or diving into a good book, keeping your brain challenged can help build cognitive reserves, giving it more capacity to compensate for early signs of damage. Maintain social connections. Staying socially engaged is just as important for brain health as mental and physical exercise. Engaging with friends, family, and community members can provide emotional support and reduce the risk of depression, which is a known risk factor for dementia. Regular social interaction also keeps the brain active by encouraging conversation, problem solving, and emotional processing. Participating in group activities or even just staying in touch with loved ones can make a significant difference in maintaining mental clarity and emotional well-being. By incorporating these preventive measures into your daily routine, you can significantly reduce the risk of dementia or slow its progression. The earlier these lifestyle changes are implemented, the more effective they are at protecting your brain. Now that we've covered prevention, let's look at some early warning signs that you should be aware of and the actions you can take if you notice them. If you start noticing symptoms that might signal the early stages of dementia, it's crucial not to ignore them. Taking action early is the key to slowing or even preventing the progression of cognitive decline. Here's what you can do if you notice any signs. Get a cognitive evaluation. The first step is to seek a professional assessment. A cognitive evaluation involves a series of tests that assess memory, attention, problem-solving abilities, and other cognitive functions. A neurologist or another healthcare provider can administer these tests to determine whether the symptoms are related to dementia or something else. Early detection through a cognitive evaluation can help pinpoint the exact cause of the symptoms, allowing for targeted treatments or interventions that can make a real difference. Request a blood test for biomarkers. Recent research has shown that biomarkers in the blood can detect signs of Alzheimer's and other forms of dementia up to 20 years before symptoms appear. These biomarkers can provide crucial information about the early stages of neurodegeneration, helping doctors identify changes in the brain's chemistry long before cognitive decline becomes noticeable. If you're concerned about your cognitive health, ask your doctor about the possibility of a blood test to check for these early warning signs. Track symptoms. It's important to keep a detailed record of any changes you've noticed in your memory, mood, balance, or other cognitive functions. Tracking your symptoms over time can provide valuable insight into whether the changes are part of normal aging or if they are something more serious. For example, if you've been experiencing sleep disturbances, mood swings, or increased social withdrawal, make note of when these changes occur and how they're affecting your daily life. This information can be invaluable during your medical consultation, helping your doctor understand the severity and progression of the symptoms. Additionally, keeping a journal of changes in cognitive function can help identify reversible symptoms, such as sleep issues or social withdrawal. Many early signs of dementia, like sleep disturbances, can be improved with lifestyle changes, stress management, or targeted treatments. By tracking these symptoms, you can identify patterns that might indicate something reversible or something that needs immediate attention. By being proactive and seeking help as soon as you notice symptoms, you increase your chances of managing or even reversing some of the early effects of dementia. Early action can make a huge difference in the progression of the disease, allowing you to preserve your cognitive function and live a full, independent life for much longer. As you start to take action, keep in mind that there are other steps you can take to protect your brain and slow the progression of dementia. Let's explore how lifestyle changes and therapies can support brain health and help you maintain cognitive function. Taking early action is crucial when it comes to protecting your brain from the effects of dementia. By recognizing the signs early, tracking symptoms, and seeking professional evaluation, you can make informed decisions that may delay or even prevent cognitive decline. The lessons here: prioritizing sleep, maintaining a healthy diet, staying mentally engaged, and staying connected socially are not just for those worried about dementia, but for anyone looking to lead a healthier, more vibrant life as they age. If you found this video valuable, make sure to support Health Horizon by subscribing and sharing with friends and family. Together, we can spread awareness and empower more people to take control of their health. Thank you for watching, and let's continue on this journey to a brighter, healthier future.